I've been bicycling since 1971 when I first started riding adult bikes. I try to get out 3 times a week, sometimes 2, depending on the weather in the winter. For about 2 years, when I was going on long bike rides, my knee would just ache afterwards. I started taking some ibuprofen before I went bike riding. It would kind of calm down my knee a little bit and make it comfortable. And then gradually, that just got a little bit worse, a little more uncomfortable. I wanted to get a knee replacement because I knew it was not going to get any better. I chose Dr. Postma because I had known him for quite a while, and he had operated on my knee with a meniscus surgery and also operated on my wife's carpal tunnel. He has good bedside manner. He listens, and he is just really intuitive about what is going on with, a particular part of your body. Watervliet Hospital was a marvelous place to get the surgery. It was quiet, the staff were remarkably good, the surgery went well, everything was just easy. Now, it doesn't bother me when I'm riding. That's the difference, because when I was riding, even with the ibuprofen, I could feel just a little bit of uncomfortableness. Now there's a lot less pain.